is Nathan Sackett. I'm an addiction psychiatrist. So that means that I treat people with co-occurring psychiatric disorders and substance use disorders. And as you can imagine, the treatments that we currently have are profoundly limited. And it was about halfway through my training that I began to hear stories from patients who were using psychedelic and plant-based medicines to treat their substance use disorders with profound results. And it was quite moving. And that led me to reach out to meet actually a lot of my co-panelists here and explore this topic in more detail, and ultimately led me to the career that I have now as an addiction psychiatrist who also does research in this area. So let me just briefly talk about psychedelics and addiction. So first, when we talk about psychedelics, I want to be very clear that when I use the word psychedelics, I'm talking about psychedelic-assisted psychotherapy. This is not anyone going to some party on Friday night and taking a bunch of substances of unknown origin. This is a very intentional and organized practice where someone takes psychedelics with a therapist. They have preparatory sessions, they have the session with the therapist, and then they have what are called integration sessions. And it's in this structured environment where we have seen over the years profound results, particularly for substance use disorders. And in fact, this has been going on really since the 1950s. First was with alcohol use was some of the early studies that were done. And it was through these early studies in the 1950s that it was noted that psychedelics can be catalysts for profound behavioral change. And that's the key here, that these substances, they work to motivate and to catalyze change and engagement in behavioral treatments. They're not a magic bullet, but they certainly can accelerate the care. And I've seen this firsthand with lots of different people. So let me just give two quick examples to, I think, highlight some of the numbers. Oftentimes, physicians like myself throw around numbers and it can seem pretty overwhelming. But I want to first talk a little bit about alcohol use disorder. Alcohol use disorder is one of the most difficult things that I see because it's so pervasive, so culturally normative, and yet so incredibly destructive. Now, for context, the first-line medication that I use when I see someone from a pharmacologic perspective is a medicine called naltrexone. It's a great medicine. It works quite well. The number needed to treat when I treat someone with naltrexone is 33. Number needed to treat, what that means is I need to see 33 patients that are all similar. I need to give them naltrexone every day, and they need to take it correctly. Out of that 33, I will see one positive outcome. And in this case, a positive outcome is someone not drinking. So that's actually pretty good in my line of work in terms of the efficacy of a medicine. Studies have looked at things like LSD historically for alcohol use disorder. And the number needed to treat for alcohol use disorder with one treatment of LSD is 7. That is a profound difference than the standard of care that we currently have using naltrexone. And there's been some follow-up studies that have looked at other similar substances. Bogenschultz in 2016 did a study where he took 10 alcohol use patients, gave them 3 psilocybin sessions, and at 12 weeks, there was a 50% reduction in alcohol use. Again, these numbers in my line of work are profound. My last example was with tobacco. Tobacco is similar, it's a huge public health issue. We see it everywhere. It's incredibly hard to quit. And in 2014, a study out of Johns Hopkins took 15 smokers and gave them psilocybin. And at the end of their treatment, when it was combined with a behavioral intervention, 12 of the 15 of the participants had stopped smoking at 6 months. They did a follow-up study. At a year, 10 of those 15 patients remained abstinent from tobacco. Again, these numbers are staggering that I don't ever see in any other medicine that I have available in psychedelics. So I'm just about out of time, and I'm just going to wrap it up by saying that psychedelics are profoundly safe when they're given in a controlled environment with skilled professionals. They clearly act both on a physiologic level and on a psychologic level. And there's growing evidence to suggest that they can have a profound impact to motivate change for substance use disorders, which is obviously a huge public health concern of mine.